let me take this chance to welcome our distinguished guest for the session. And the topic is health and technology. And ladies and gentlemen, please join us on the stage. And each of them are truly an expert in their field for each application and each sector. But all of these are going to be about health and technology. So good afternoon, ladies and gentlemen. Thank you so much for joining us on the stage in this panel talk about health and technology and insurance. And to begin with, so we could get to know more about each of you. So can you please introduce yourself briefly and what you are doing at the moment? Because I really have to say that all of our panelists they are from different parts, even though they are working under the health technology, but it's truly comprehensive. We have elders, we have doctors, we have pharmacies and health tech in general. Can you start, please? Hello, my name is Kosalyawat. I am currently the director of the National Health Foundation. I am working in solution pharmacy and drug safety. We have a AI system to help you verify the drug safety. Next, please. Hello, I am Dr. Kanapon. I am a founder of Health at Home company. We provide service for elders at home. So we provide caregiver service to elders. And thank you so much. As we already know that we are working like an online doctor, and we also have a team of caregiver to provide service. Hello, I am Jinnipa Panyawuthikrai. I am a founder of the PharmCare company. We are a network of health service provider, including clinic and pharmacies. We have approximately 1,000 pharmacies within our network, and we are part of the healthcare service provider, especially for the insurance customers and as fringe benefits for companies. Hello, I am Dr. Wit Paphonwit Chaiwatanodom or Wit. I am a CEO and founder of Agnos Health. We provide health AI service, and we create the symptom checker application where everybody can use for initial screening by yourself at home. And this has been the 5th year in our business. We have expanded our screening services to other conditions, including mental health and also elder conditions, especially for brain health. We also have the automation system in healthcare service. We are working with the hospital in develop smart hospital process with AI and automation system where I can help automate the manual work at the hospitals. So that helps saving a lot of manpower. Maybe you are one of his customer, I'm quite sure. So can we start with Mr. Jack? Whenever we talk about health tech, I know that Jack has been in the health tech industry for a long time. What is the most important challenge where it holds us back from applying health tech and drive the tech in the health industry? So may I say, from the perspective of the Health Tech Association and also the foundation, the biggest challenge for Thailand is to work integratedly, because the healthcare system is a very big system with smaller systems underneath. And more importantly, when you talk about digitalization, this network, or to make technology an integral part of the system, we need everyone to make sure that there's interoperability. Now in Thailand, our healthcare system is quite fragmented, and especially at the hospital, we also have public hospital and also private hospitals, hospital under the ministry, under the Office of the Secretary, and also medical schools under different ministries, like the Ministry of Science and Higher Education. And we also have the hospitals like police hospital and even some of our private hospital even listed in the stocks market. As you can see, it is truly fragmented. And by being fragmented, it is a big challenge in developing certain technology where it can work interoperability. So this can be a very big issue. So you mean that because the data are from many places, sometimes it's very hard to integrate, right? Yes, integration. Actually, there are many aspects of integration, and part of it is the data system where, for example, all kinds of services from patient care, from the primary hospital to the secondary to the provincial hospital to the experts or at the medical schools and specialists, including the health fund and also the policy maker, regulators. Actually, everybody must move at the same time in order to make a significant change in the industry and to make sure that everyone can work together. Technology is very important because it's just like we want to produce a car, but we cannot just produce a car for making a car's sake. Actually, if you want to produce a car, you need to think about the whole infrastructure, like the traffic law and how each of the city designs are being connected to other stakeholders. So everybody works like a project based. Like startups are doing their own project, the government is doing their project, but their project can solve only certain points of the supply chain, and everything cannot work with each other, so we cannot grow. Let's say if we have a source of a big data where we can pool together the same data, because earlier we mentioned about big data, maybe that can be very helpful, right? That's partly, yes. Partly, data is a very important resource, but there are many other components besides of data for such a large infrastructure like policy, law, manpower, and also tools, locations, and human resources. So simply put, we need a true integration because that is the biggest challenge. Yes, it's the biggest because the system is very big. When you talk about integration, you can spend the whole next week. Yes, I'm trying to make it softer, but we know that it is a very big project, right? All right, let's move on to the next doctor. So we have heard a lot of podcasts from you because you are a very good storyteller. And whenever I listen to your podcast, I want to be a healthy person. Dr. Tan, because Thailand is getting into, actually we are already in the aging society and more than 20% of our population has been elders. And we are seeing a big shift in our healthcare business, especially in the past few years. There are many new businesses to prepare for elders and especially the service, especially for the elders. I believe that technology allows us to do more than that, right? And can you tell me more about that, sir? I think technology is very important because we have a lot of elders. Speaking of the infrastructure that we have in our country, the government alone cannot really take care of everything because we don't even have enough budget. So the private sector is still very difficult. The key is innovation. And innovation can come in all sizes and forms. It can be prevention, wellness, and comprehensive care. But when I started with something at home because I find that as we have more elders, there will be more people who need extra support. If we can make your home a destination elders can stay very nicely. They don't have to rely on other caring facility. That can be an innovation where we can help offloading the system. But I think we can do this everywhere. There are so many things that we can do, especially for aging society, because aging society is very big and we haven't seen the real wave coming in. And especially when you look at your parents, and especially imagine they have siblings like 5 or 6 siblings. Imagine that your grandparents are that much. Yeah, they are a very big family, right? We used to have extended family. In the past, there used to be a handful of older people. But in the future, there will be more demand because there are more people and there are more elder population. We will see a next big wave very soon. All right. Next, Kun Ing with PharmCare application. I think PharmCare I find it is the most approachable app because sometimes, you don't want to just go to the doctor, right? You choose to go. I'm sorry, many doctors here. Many people don't want to go to the hospital, but they want some support from the pharmacy. And there are many pharmacies next door, but sometimes you don't get to meet the pharmacist. Or sometimes you just want to have some, Grab or hail riding services to grab the drugs for you, but I don't know if they get the right, and sometimes you have more symptoms than what they can. I think this is a very good service and you open up until 8 in the evening. So what makes you feels like you want to create this application? What you want to change for healthcare? You really understand what I am trying to do. I want to make it simple. But I'm sorry that maybe they can help offloading some jobs from doctor. Yeah, maybe thanks to the doctor, we have our business. We can help you with some initial diagnosis. And the inspiration was at the beginning, I have to say that I grew up with a pharmacy. And actually, my mom is a pharmacist. she owns a shop, and I learned about how community pharmacy works, and it really takes really good care of the patient because we have more time and there are lots of regular customers. So that has been my inspiration. We should bring this kind of underutilized resources in Thailand. Not everybody could get access to these kind of services. So I was thinking about the network of pharmacy, just like making pharmacy even more powerful, because when they create a network, they could offer a better services, a more comprehensive services, and they can set the standard for the services, for example, and that will be benefits for the Thai people and the Thai health industry. So besides of the census, you have the actual on the ground data from the people. People in the community, right? I think that is very important because sometimes they don't have access to advanced healthcare services, like big hospitals and even public health service. But the local pharmacy is always next to them. So once you have created a system, you can provide a more comprehensive service. All right, okay. Now coming to Kunwit. He is known from Shark Tank, right? Can I mention the name? All right. Agnos has been one of the leading health tech startups and up and coming. So I really want to ask you about the application that you developed for the healthcare business. How can we go global with that? We are not going to stop at Thailand, right? How can we go global with your application? Thank you. And we have been 5 years at Agnos. We have developed a medical AI since from the point where the hospital even called me crazy when they want to use AI in the hospital. They told me I was crazy. But today, nobody never say that to me anymore. And if the objective is to go global, I would like to say that healthcare is among very few sectors in Thailand that is considered a world-class sector. Maybe there are some sectors we are not very good, like large language model. Okay, we are not very good at the moment, but healthcare is one of a very few leading sectors where Thailand can compete with other countries basically. In that sense, if Thailand wants to develop a world-class AI, we need two things. First, data, as everybody talks about data today, and second is talents. And yes, we have our talents, maybe not a very big pool of talent like other country. Data, yes, but it's very fragmented, like he said. In order to develop an AI where we can go global, we need enough data in order to compete with the world. In many countries like Korea, they have a special agency where they can centralize and manage the data with good data governance, and we don't have that in Thailand. This is very important for Thailand because if we have this kind of agency, it can uplift our AI capability as well as development, where I can make Thai doctors are one of the best in the world. And so there's health technology. Yeah, our doctors are here. I strongly believe that we have the capacity. We have the potential. Just a little push from the government with some incentive. I think this is one of a very few business sectors in Thailand where we can compete at the global level. And we really need to give it a push. So we could go beyond just the data and the talents that we need. We need to attract even more talent to us. Data center is a good idea, yes. I think the government started to see the data center as a beginning. But with data center, it doesn't give us the answer. But what we will get, we need new technology and we can sell it to the world. So you mean that data is part of it, right? Data center is part of the infrastructures. And there's no ownership involved. We want to attract them. We want to attract people to invest, but it's just a very, very basic thing. In order to acquire enough sets of data, large data or big data, and to turn that into something useful, and that will benefit not just our companies, but also the government, and also we can sell it to the world. But do you believe that in the future it will be better? Yes, maybe slowly. Thanks to Agnos? Yes. Yeah, together with them, right? Not just me alone. We need their help too. We need the whole ecosystem. I think Kunjak previously mentioned, because we agree that Kunjak say that it's a very big problem. So let me continue from the previous question. As the Agnos team just mentioned about the government has been trying to consolidate the data. There are some data from the government and some data from the private sector. How can we work together with the government? Like on behalf of, let's say, an NGO who works under the government, and how do you collaborate with the government and private sector, both sides? Can you share with us how it's like? Because I also have my own startup, and I also work at the association, so I'm between, in the middle of the private sector and also an NGO. NGO is a middle ground where we can connect between the public and private sector. The public sector has a certain mindset where they might need some shift in order to work in a more integrated manner, because the sense of ownership, especially, it's not just the sense of ownership. The data, for example, we have to admit that Thai public health system is being dominated by the government, let alone the local hospitals. Like we have 1,200 big hospitals and only 300 private, and also there are more than 200 million visits or subscriptions at the government hospitals. So if you want to develop a country level digital health or digital technology, the government must understand first that they cannot do that alone, because they own many data, they own many things. They can be a very good host or very good champion, but there are more successful countries, and with that it was because they have good collaboration with the public sector. First, how can we create trust between the government, the public and private sector? As I am working at the foundation, I can feel that NGO can be a very good intermediaries to connect between the government and the public and the private, to create a middle ground where the government can see that they are not giving away what they have for free to certain private entity. But on the other hand, the private sector can also feel like they can trust if they can work in a middle ground where there's an intermediary can help them integrate with other stakeholders, such as many government agencies. Like what we are doing at the moment, one of them is to develop a screening, especially for genetic disease for the mother and child, start from the pregnancy, like Down syndrome, thalassemia, hearing impairity, and Down syndrome and metabolic syndrome, for example. So based on the NSHO, we know that there are 50 million users under the National Health Scheme. How can we make the newborn child to suffer less from this disease or illness, or to have at least to early detect this risk, so we can provide the right treatment, or so that we can help them get access to the National Health Scheme, for example. This is a model where we can show that if you want to work together between public and private sector, we can just start with a shared goal, and then we can work together to tackle the issue use case by use case. And one success, I believe that the government will be more welcoming, because they also have the benefit from less children that get sick with those genetic disease. The cost of care and the cost of treatment is very, very different if you could treat them early on. Comparing with taking care of them for the rest of their life, it is a huge cost for the government. If we can do that, we can help them reduce the cost they need to spend on disabled people, and the private sector can also help developing the system to support that. I think this is a win, from both the government sector and also how can we slowly approach them. But the biggest problem is speed. We have to admit that Thai government is moving very slowly.
ของปัญหา
And also the other issues like people's well-being and quality of life, that makes things very slow. As you say, we cannot wait. I think one other thing is to try to centralize everything and integrate everything. But I think I started to see a very positive sign from you, because the approach, we started to see that first of all, you are in a non-profit standpoint, and your approach is much more friendly to both of them. Yes, that's a part of being an intermediary. We need to help setting the goal together, and there are limitations and different point of views can be sorted out in the middle way. But I hope that once you are working in health tech together, we know that we want to solve a problem for every patient. We don't want to do it for yourself, right? In the end, if we start at the right goal in mind, it allows us to work together. Or even we want to prevent more disease and more patients. I think it's the same goal, right? Because it will lighten up the burden for everyone, like the doctor, the pharmacy, and even the management, just from one fully integrated data set. Okay, let me continue with Dr. Tam about health at home. What is your community strategy in order to handle with elders? Because sometimes elders and health tech, I think it's not easy for them, right? Because maybe it's very hard to open their mind or help them get access to the data, to the tech. How can you help preparing the elders to use the tech? Because that's your target segment too. Actually, elders who are using health at home service they already started to need to rely on someone. They have certain demand, especially they have more health demand than usual. If they are healthy, they don't have to worry about that. Yeah, they are not user. They don't have to take care of themselves. I mean, they don't even need to have a housemaid. But there are some people who, started to show some condition where they need to rely on other people, like stroke or after operation, or they started to have some disability. Those are some of our patients, and not all of them are elders. Some of the people are their cousins or people who are like next to their kids who wants to take care or who need support to take care of their parents or their elders. We normally say that every family who call us, they must have some problem, because you understand, right? Because if you have everything, you don't have to call us. Some shit must have happened before they called us. So we know, that's the fact. We know that there are certain situations, certain change where they need support. And our job is to help restore peace in their home. Basically, because we know that there's more than just health issue. We know that there are some stories behind that. And we need to provide such support to bring peace back to their family. But access is not difficult because their family member normally are useful websites and applications. The hard part for health at home is more about there are so many people in the loop, especially starting from the caregiver and then patients, and then what's the chemistry between the caregiver and the patients and their cousins, and sometimes even their housemates. Sometimes there are pets. Yeah, it's about management. So many stakeholders in a place. That's the biggest challenge, because the more people, the merrier. There can be hundreds of problems. Yeah, because if they have no problem, they are not calling you, right? Yes. And maybe if it's something simple like cleaning up, it can be there are some times where the patients, they don't want to rely on their cousins, or they just need somebody to take care of those chores. But most of the cases, they have more specific needs. So your mentality, you also take care of the mental health. Yes, mental is quite an issue for them. If we can make them feel better, because mind and body are connected. If they feel good, if they don't feel lonely, if they feel like they're in a place where they know that they have been through a certain change in their life and they feel insecure, they don't feel very good when their children takes care of them in things they used to be able to do. They feel very bad, right? And sometimes your mother gets sick, you need to treat her with respect. That's very important. You need to make sure that they maintain their value, because their body is going bad, and we cannot just send them the wrong signal, because they will feel even less valued. We want to make them feel the value, and they can still do things. So mental is as important as physical, but you can do even though your parents are still healthy, you can do that. You should do that too. So mind over matters, right? But sometimes your body takes the lead, but that's understandable. However, let's go back to Ying once again. So what do you think it is the biggest pain point for your consumers, and how PharmCare can help solving those pain points for the consumers to the point where your business could grow this big? And what is the biggest challenge? Okay, so let's start with the pain point. There is a pain point from the players and the other end, because in Thai society, we know that we don't just pay for our own medical fees all the time. There are some self-pay or out-of-pocket patients, but on the other hand, they use the benefits from maybe the government scheme, or maybe the benefits from the company or under certain coverage. The pain point is actually the medical inflation. The cost for getting access to healthcare is increasing every year, and nothing can stop it. But what we can help is to help them manage and to look for value for money for them. We know what kind of service is suitable for the money they pay for us, and will not be their future burden for our customers. For example, like you mentioned, it's very easy to access. One of the main goals for our service is if they could get to our service easily, there will be more interest in taking care of themselves or their health. So in the future, they will get sick less, or they will receive treatment faster. That will be translated to lesser burden to the family and for the company. Okay, there are some save up there, so that's the value besides of the value for money. Okay, now let's jump to Kunwit. When we talk about AI, like the past 5 years, it sounds a bit very new, but today no more question. However, what is the biggest challenge in using AI in medicine? How AI can help you in the medical sector? Based on the experience, there are two main things about AI. So one way it helps with the healthcare processes. I mean, we can automate numbers of tasks. For example, when you walk into a hospital, do you still see a lots of manual work? Even private hospital, even leading hospital and healthcare center, there are still lots of manual work. You still take notes on the paper, and even the cue card, you still have a lots of cue cards handing out every day. Or lots of process doesn't look at or connect with the overview. And even the doctor's note, okay, sometimes they are still writing on the paper note. Sometimes they start to type. Sometimes they have an assistant to help them. And everything is still pretty much manual. So this manual process, you can use AI to support that very easily. And within just the next couple of years, I think we will see more AI helping automate lots of processes in the overseas. We have seen that so many places in Thailand. It will be very soon. There shouldn't be that much barrier of entry. However, on the other hand, where we see a bit more barrier is to use AI to help with the treatment or diagnostics. I think there are some challenges there. Part of the challenge is because of the process in order to get there, in order to get to the actual application in the clinic and with the patient. I think the process before we could get there to file for the filing process for approval is still very slow as far as I learn from other people who went through this process. We know that comparing with many countries, we are still very slow. And if you really want to be on par with other countries, we really need to have a sandbox system, a sandbox where you can apply these systems to test and to get the approval process. And actually, we should have a more standardized approval process for this kind of job. I mean, we are relying on other countries' system in order to verify that, okay, you get approval from that country before you get approval in Thailand. So many startups in Thailand who works in AI need to flat away to get approval from overseas in order to get another approval in Thailand, like FDA, which a bit doesn't seem like a good way to go. If you want to be a leader, if you want to export technology, especially for healthcare AI, we need to change the whole process for the whole ecosystem. Especially in order to adopt this technology, how can we test and go through the process very fast? We must show the actual advantage, unless we cannot really compete. Yes, because everything you mentioned is very sensitive, but time sensitive. The faster, the better. The faster, the more save up. The faster, the better competitive, for example. I believe that in healthcare, it must be safe. That's the first step. It might not be optimized for time, but it has to be safe too. But in order to get to the safe point, it must go through certain tests. But it's chicken and egg. Without approval, no test. Without no test, no approval. So you cannot start, right? We need to start somewhere. While other people get a faster approval process, they could attract more data and could attract more talent. We cannot compete that. So the biggest change is possibly coming back to what you say, sir, centralized, decentralized, and integration. Once again, because we need data from everyone, and maybe we will need, what's the word for that? We may need to have a better procedure for that. What about a closing remarks for this session? Can all of you share your thoughts on what can be the biggest game changer in order to set a new direction for success and for the public-private, and how can we make that change happen? I think this sounds a bit broad, but if you can choose one game-changing tips from each of you, what do you think it could be? It could be a game changer for AI and technology in Thailand to develop faster.
Okay. Game changer จริงๆแล้วมันมีทั้งที่เราตั้ง
About game changer, and it happens sometimes well intent, like COVID, right? Yeah, you can call that. But what we already know is that Thai public health industry is very conservative, and it's very hard to change. COVID is a very good example. The crisis forced us to change. We need to adopt technology and innovation, and it happened very fast. And we need to work together because we were forced to. It happened once, but it's already gone, right? what can be the next game changing is actually there are many options because there are many challenges in the healthcare industry around the world, like aging society, for example, the money that we can support people's health. We don't have enough resource. Everybody in the world know that we don't have enough. Even though social security, do we have the solution for that? But the bigger challenge in the future, actually we started to see that and we haven't started acting on those things, such as, let's think about our grandchildren. Imagine that every kid, like 30% of them, can live beyond 100 years with advanced medical technology. Maybe, yes, we can do that. Even though your son or your daughter can live beyond 100 years. But at the same time, our social or economic structure and even insurance and healthcare system are still looking at 75 or 80 years as a basis. So what can we do for the next 20 years beyond that they have to take care of themselves? Do we have an innovation? Have we changed the healthcare system? Do we have the new social structure as we have that many old people? Our retirement age is still at 60 or 65, while the people in the next generation can live beyond 100 years. I would say more than half of them. Do we prepare for that? Have we? Have we not? I don't know if we can call that game changer, but whenever you see a problem like this, just don't wait until shit hit the fan. We don't want to. We don't want to be forced by another crisis. So we should plan ahead of that. How can we prepare our social and economic structure? What about healthcare system and even insurance system? Are we still using a 6-care model? Can we still use the 6 insurance model? At the moment, our insurance covers certain illness. It's not a really comprehensive health. It's just like betting on the fact that you will get sick or not, right? Because you don't want to get paid because you get sick. Can we still using the same logic? Because as people are living, going to be beyond 100 years, we need to work together and we need to start now. And we need to start looking for a solution. We are talking about current issue, right? It's not future. It's the same issue that we have seen in the past 30 years. We have seen that. But the bigger challenge for the future is a much larger issue than whatever we have solved so far. And we should really take that seriously. So, Kun Jak, your game changer is that if you think the issue today is bigger, the future is even bigger. Yes, I think that's quite a concern because yesterday I just saw some details for my dad's policy, but it covers only 79, but he's still very strong. And in the past, our retirement age used to be 60, but we are still feel like a teen, right? Even though at our age. So that will be a big chunk of people in the future. I think this is a very good opportunity that you have mentioned that on the stage. So people are being aware of that, including myself. So maybe I need to start thinking about that game changer. How can we prepare and what can be the solution? Once the world has changed, can we change anything before the change has come? Okay, same question, game changer. I know you gotta get a good answer. Well, for me, I think it's about the regulator. Based on one of my most favorite book, it's called The Third Wave by, I think this one was when I was starting my business at home business. They say that the third wave or the third opportunity for the existing industry like media and other industry, there are already some winners, but there are some industry like healthcare and education and agriculture. And the question is why? And they say that one of the biggest component of this industry is the regulators. So once there's a regulator, the regulator is doing a very good job keeping them on track because health affects people's life. So you cannot just let anybody do everything they like. But likewise, innovation can only develop based on experiment. You must go through experiment, but if there's no room to experiment, there will be no innovation. And just like what you say is the data, is the license, and so many other things, I find that regulator can be the game changer. And as you can see, many countries where they have adopted InsurTech and HealthTech in the country are the countries where the regulators understand about technology and they're open enough to, just like Dr. Witt mentioned, that they are open enough to let them do their things in sandbox. I think they are very similar. Yes, like I think today, what we are here today, like under CIT, this is a very good initiative. We want to bring people from different industry to help us prepare for the future. This is important because unless the business operator and people who want to seek innovation, they don't know what to do. Like let me share with you a case. I started working in my position 8 years ago, and they told me that what can we do in order to unlock the legal structures and to allow this kind of service. But it appears that there's no law. But there's no law at home. There's only law at the medical institution. So I was wondering what I can do. Okay, what about you do it first? And if there's any mistake, there will be more rules if you make any mistake. But there's no rule at the moment. So there's no law, right? So I can do whatever I like at the moment. But yeah, that's the way to go. But you still have to do, but based on the right fundamental. I think it's a high risk. It's exciting, yes. But when it's high risk, there are many operators who will be interested. But there are many who are not, they don't want to jump right in to this kind of risky business, right? But the regulator will be a very important part in this. So let's say in the third wave, once the regulator is clear, like regulation is clear for this occupation, this business or this application, like health at home, for example, or maybe 1, 2, 3, 4, 5, it will make things faster. Do you think so? It doesn't have to be fast. I think it's already very difficult because the regulator already have a lot of downside. They cannot make any, mistakes because they don't have a lot of upside to gain, right? But sandbox can be a very good place to start. Maybe if there's a place where we can get together, that would be nice. But at the moment, we know that things are still very difficult. We understand that position, but we must do it anyway. Okay, it doesn't have to be fast, but we need small sandbox. Yeah, start with him. I think he's a good place to start. All right, what about Miss Ing? And for you, I think it's a very, what's the word for that? Very good service. And your target is people who are health conscious or actually they already have a good mindset. But what about the game changer where you still want to change something? I actually agree with our doctors here. And like Dr. Tam, you mentioned about the third wave. I was reading the same book. Wow. Oh, yeah, that's why you're here. Yes, and regulators are very important. And on the other hand, we are here in the InsurTech. So I want to talk about the insurance. For the insurance today, they bear a very big burden at the moment. They need to take care of the customers, the insurer and the policy holder. And you still have a lot of surging clinic costs like the medical inflation issue I mentioned. So the game changer I say is that we cannot stop the marching trend of the increasing cost. But what we can do is to bring together people from their own areas to come together to help us design the long-term solution. Unlike a short-term integration opportunity like what we have done so far, we just don't want to solve the upfront issue, but we need to look longer because we know that we have our areas of responsibilities like the government is a foundation, the private sector. If you can make it a little more affordable for people, is that okay for you? And what about people who can afford the service and take care of themselves? They can afford a more premium service. They can just use the premium service in the hospital, but that is not always the case. But I want everybody to share a more aligned direction, strategic direction. And as we are business operators, once we see that direction, we can help you being part of the jigsaw to help filling the gaps in the picture. So for you, it is more about alignment, and alignment is also very important. So whenever you want to create a product or service, I think the vision is very important because if you can look towards the same goal, things will be easier to manage. And you mentioned briefly about medical inflation, and people get older. And what about the customer? The customer has to pay higher and higher premium in the future as they get older. Yes, in the end, it will go back full circle to if the people wants to buy the insurance, and that depends on affordability. If the medical inflation has reached certain point, the insurance cannot decrease their premium anyway because unless there will be net loss. In the end, it will go back to the same point. It's the consumer who will have to bear the burden of the cost. So why shall we find a strategic solution to make the insurance more value for money, to provide more options from very economy to very premium and many in between to give more options to the people. I really understand what you say, ma'am. That's truly a very good roadmap, and I think it's a very good thing to share with everyone on the stage here, so we can start walking towards the same direction. Okay, to close with So what should be your game changer? What should be the end game? Okay, not the end game. So let's say, what should be your final thoughts? Maybe I would like to add about something that we haven't covered today, like regulators. I strongly agree with those points. They are important, but in fact, from my point of view, I have seen that many activities are more defensive at the moment. It's not really proactive. Like for example, when we say that the healthcare cost is getting more expensive, and there's nothing much we can do to lower the healthcare cost except cutting the budget or expense for the hospitals, which is not the right way to solve the problem. I believe that would it be better if we set a special budget for both public and private sector to take care of these issues in a more proactive manner. Let's say looking for a technology to support that. We can set the target like the more you lower your cost, the more incentive you get. There's no economic incentive that allows us to encourage the innovator or to encourage them to look for a new way to help you reduce the cost, because there is no incentive. That's why even the startups they don't know what to do. They don't even know if what they do will get money for them, and the regulator don't even let them do that. So there's no way for the innovator to get in or help you create any solution, because there is not enough incentive, and there is no incentive model from both public and private sector that allows you to explore some creativity or new way to reduce the cost in the long term. So today we are in a defensive position. You just cut the cost, and the burden goes to maybe the hospital or the people, and it goes back and back and back. So in summary, incentive is important, right, for everyone and every stakeholders. I believe that our game changers are all very important, equally important, but it depends on maybe where you are looking at or where you are looking from. However, I believe that today this is a very good opportunity to learn from all of you, sir, ma'am. You are considered the leader in AI and health tech, and I believe that together we can help driving the industry, maybe not driving the whole industry by ourselves, but with our experience, we can share some of the practices and experience where I can help further develop the products. So I think we have 2 minutes. Any final thoughts before we close? Kun Jak, you seems like you want to say something, right? Wow. I feel like you raised my hand. Okay, so I don't want to make it sound so stressful, but however, okay, anyway, health tech can solve one big problem, which is called disparity. If we don't do anything with the system per se, I can predict that in the next 50 to 60 years, there will be only 2 generations of people, which will be 65 and 120. There will be no 80, no 90, because with such inequality, people who has enough resource will live longer thanks to the technology and the resources they have. However, people who don't have, they will pass away at about maybe 85, or maybe they will need to get into palliative care system only. So there will be a very big gap in the society if we don't do anything. And many countries, you don't want to see that, and you are not even aware, because we still enjoy with the technological development, economic growth, and all the new things, or things that we are pushing the limits as a human nature. But what we share in common is the resource. If we forget that we have limited resource, this will happen. And technology is the solution, plus the policy and the vision from each country's government, where we need to take this issue more seriously. It's not just that the haves can buy, the don't-haves cannot buy. It's about people's lives. And imagine the gap can be that big. So maybe some food for thought. I don't have the answer for you. I just a very small piece of cogs in a much larger system where I can share my thoughts and tell you what we should look at in the long term. So in sensitive, in summary, politics is personal. We are running out of time, so thank you so much. That is a very good closure for the whole session. Thank you so much for Dr. Chak and all of you. Thank you so much for joining us. Mr. Chak Kosalyawat, the Director of Digital Health from the National Health Foundation, Mr. Kanapon, the Founder, Health at Home, Ms. Jinnipa Panyawuthikrai from PharmCare Group, and Paphonwit, Chaiwatanodom, the Chief Executive Officer from Agnos Health. And once again, please put your hands together for our panelists. Thank you so much.